Hi, my name's Elmaine. I'm a family nurse practitioner student, and today we're going to be doing our abdomen and musculoskeletal evaluation. Hi, if you can just say your name and birthday, please.
Sure. This is Susie Sams. Birthday is 7/22/1964.
Perfect. And what's the date today?
Today's 3/11.
And do you know where you are right now?
Yes, I'm in Troy.
Perfect. Perfect. Okay, so first we're going to start with our abdomen assessment. If you want to go ahead and lay back with your head on the pillow and we'll put our feet forward. And then is it okay if I just raise your shirt a little bit so I can see your belly? Okay, so first we're just going to start by looking at the overall abdomen. We'll be using tangential lighting, so we'll just pretend. But we're looking for contour, symmetry of the umbilicus. We're looking at her skin and the hair on her belly, looking for any rashes, lesions, striae, anything like that. And then also looking at her, looking for any paralysis or any aortic pulsations, which I do not see. So now we're going to go ahead and auscultate in a clockwise position, starting in the right lower quadrant. Using the diaphragm, and we're looking for any, or listening for bowel sounds. And bowel sounds are present. So now we're going to check for hernia. So I'm going to look for the epigastric, umbilical, and inguinal areas for any hernia. So as I press down, just go ahead and cough. Cough. And then any pain there when I was pressing. Okay. So now we're going to go ahead and auscultate the four quadrants of the belly, and we're going to use the diaphragm and the bell. We're listening in the epigastric and umbilical area for the venous hum. We're also going to listen in the aorta, and then the bilateral renal, iliac, and femoral arteries. And we're listening for brutes. So we'll start with the diaphragm. And there's no brutes noted, so now we'll switch to the bell. And there's no brutes noted there. So now we're going to percuss all four quadrants. And now I'm going to palpate femoral arteries. And those are both 2+ bilaterally. So now we're going to move on to the abdominal palpation. So I'm going to palpate all four quadrants. I'm palpating for any masses, anything like that. And then just let me know if you feel any pain as I'm pressing. Any pain at all when I was pressing?
No.
Okay. Now we're going to go ahead and percuss the liver. So we're going to start on the right side, right on the lungs at the layer of dullness. And I would mark that area. And then we were going to go under the umbilicus at a layer of tympani to a layer of dullness. And I'd mark that as well. I'm just pretending I'm marking, but as long as it's at least 6 to 12 centimeters, that would be a normal liver size for this patient. So now we're going to palpate the liver. So I'm going to go ahead and place my hand under her 11th and 12th ribs, and then go ahead and inhale, and then exhale. And I'm going to try to feel that border of the liver, which I do feel. So good. And now we're going to do, we're going to percuss for her spleen. So if you want to go ahead and just shift your body a little bit that way. On the left side. So we're going to percuss along the axillary line, so the 9th and 10th intercostal space. And as I'm doing this, I'm going to have the patient inhale and exhale. If during an inspiration, that layer, the resonance changed to dullness, that could be a sign that there's splenic enlargement. Just go ahead and take some inhales and exhales. And I'm listening for any dullness during that inhale, which I don't hear, so her spleen should be good size. Okay, go ahead and back in your back. Yeah. So now we're going to do our special abdominal test. So we'll start with the Murphy sign. So is it okay if I lift your shirt back up? So the Murphy sign, that would test for cholecystitis. So I'm gonna go on that right side, pressing down. Go ahead and inhale. Any pain when you inhaled? Good. So the next test we're gonna do is for appendicitis. So there's 3 of those. The first one we're gonna do is the McBurney's point. So I'm gonna go ahead and press down in the right lower quadrant and let me know when I take my fingers away if there's any pain. Any pain when I took my fingers away? Next we're gonna do a psoas sign. So we're gonna go ahead and have the patient lift her leg up with that leg straight. And we'll go ahead back down. Any pain in that right lower quadrant area? Good. Next we're gonna do is our obturator sign. So we'll have lift the leg up, and then we're just gonna put some internal rotation, and then any pain in that right lower quadrant. Good. All right. So I'm gonna have you actually, if you wanna go ahead and sit up, we're gonna palpate her kidneys for any CVA tenderness. So when I go ahead and press on that first like punch you feel, let me know if you feel any tenderness when I'm punching, okay? Any pain on either of those sides? Good. All right, so now we're gonna do our muscle strength test. So first I'm gonna have the patient press up as I'm pushing down. Good. See the other side. Good. And then we'll test her plantar flexion and dorsiflexion. So go ahead and press down first. Up like you're pressing on a gas pedal. Yep. And then go ahead and press up against my resistance. Good. And both extremities are 5 out of 5 strength bilaterally. So now we're gonna go ahead and do her her knee special testing. If you wanna go ahead and lay back down. Okay. So first we're gonna do her meniscus test to see if there's any tear, and that's called a Murray test. So we're gonna go ahead and bring the leg up, and then with a little bit of valgus stress, I'm gonna go ahead and rotate the ankle. So we're rotating the tibia, and I'm just noting for any clicks in the knee region, which I do not hear. Okay, and we'll test the other one. Again, and I don't hear any clicks as well. So that's a negative McMurray test. The next test we're going to do is varus and valgus, and that tests for any LCL or MCL injury. So we'll bring the leg up. So first we'll be pushing this way towards the medial, the MCL. Any pain on the inside of your knee? So the valgus test is negative. Then we'll do our varus test. Any pain on the outside of your knee? Good. We'll do this one. Any pain on the inside of your knee? So valgus test is negative. Any pain on the outside of your knee? So varus test is negative. So MCL, LCL are intact. So now we're going to do our posterior and anterior drawer test. So we'll have the patient lift her leg, her leg. Okay. And I'm kind of going to like sit on the foot. And I'm going to bring the tibia forward and back to see if there's any obvious separation in that knee for a possible ACL or PCL tear. Good. And then we'll do the other leg. Go ahead and lift up. Pushing that tibia forward and back, and I don't know any separation. All right. So for our next test, we're going to do range of motion in the knees and ankles. So for her knees, we've already seen her bend her legs up for 135 degrees. She's also been laying with her legs straight, so we know she can also extend them 180 degrees. So now we're going to do range of motion in her ankles. So first I'm going to have you flex your feet back like that. So we want that at least 20 degrees. And then if you want to go ahead and point your toes like that, we want that at least 45 degrees. And then if you want to go ahead and turn your toes in like that, like this. And we want inversion at least 30 degrees. And then go ahead and evert out. And we want that at least 20 degrees. So now we're going to go ahead and sit you back up, and we're going to do range of motion in her spine. Yeah, if you want to stand, and I'm going to move this bench to give us some more room. All right. Okay. So I'm going to actually have you turn and face that wall, and then if you just want to bend down like that with your legs together, knees straight, perfect. So we can see here her forward bend test looks great. Her knees are straight, her arms are straight, hands are pointed down. We can also look at her flexion right now, which is definitely well beyond 75 to 90 degrees. You could also check for any scoliosis of the spine at this time as well right now. I'm going to have you stand back up. Perfect. And our extension upon standing is at least 30 degrees, so that looks good. And then if you want to go ahead and face forward, we're just gonna do some lateral bending. Yeah, and we want that at least 35 degrees, which looks great. And then I'm just gonna have you rotate. So she has nice rotation through her hips and spine, so that looks great. The last thing we're gonna do is a duck walk. My patient is suffering a knee injury, so we're not gonna have her do that, just per her guidance of her niece. So I'll demonstrate the duck walk. So you'd have your patient squat down, and you're gonna have the patient walk forward, and then walk backwards, and then walk side to side in that duck walk. And that's it. Thank you for watching.